So my second to last question is, as a medical doctor, how would people approach and talk to their GPs about using nutrition to improve their health rather than pharmaceuticals? In New Zealand, it's still pretty frowned upon. It's considered not really relevant, and people get quite frustrated. So how would you suggest, one, that they go and talk to their doctors about these things, and two, that they can get appropriate testing for things like triglycerides and insulin and glucose and, sort of inflammatory markers?
Well, a lot of my patients with, high blood pressure, for example, is part of the metabolic syndrome. So most people with high blood pressure just have insulin resistance. Type 2 diabetes, of course, is just pure insulin resistance. And honestly, the day that my patients go on a well-formulated, high-protein, low-carbohydrate diet, the day they go on this diet, they literally have to cut a lot of blood pressure pills in half and a lot of oral hypoglycemic agents or insulin or something for type 2 diabetes. They have to cut these in half immediately, or they're literally going to be too low. Their blood pressure might be too low. Their diabetes might be too low. So you do have to work with your doctor and tell them, hey, I'm going to change my diet and I'm probably going to lose weight and I will probably have a lower need for these medications. And I think most doctors are totally okay with that as long as you're monitoring things on your own. If you have a home blood pressure cuff and if you have a glucometer at home and you're keeping an eye on these things, then you'll probably have to start cutting medications in half. And most doctors love it if you just monitor these things on your own and titrate your doses down if need be. And honestly, that's the way to go because, I'm sure your doctor cares about your health, but nobody's going to care more about your health than you. And nobody's going to have a better idea how much of these medications you need than you do. So the best way to go is monitor these numbers on your own and work with your doctor and titrate down on things. And the vast majority of medications that are prescribed by primary care doctors can be eliminated with enough dietary improvement and weight loss. So it's a massive amount of medications out there that can be de-prescribed when people lose weight and change their diet and lose weight. So you definitely want a doctor who will work with you. I think the really tricky one is statins for high cholesterol, because as you make all these improvements and all your numbers get better and better and better, your total cholesterol is probably not going to change much or go up slightly. And then some doctors can just never get past that. And if you have bad cardiovascular disease, I think you should probably take a statin. It does seem to have some anti-inflammatory properties. And I do prescribe statins to people who've had angioplasties, bypasses, stents, cardiovascular disease, known vascular disease. But if you're totally healthy and you have no vascular disease and you just have a high total cholesterol number, I'm not convinced that it's necessarily a good thing to be doing. And so at some point, you can just tell your doctor, look, just put in my chart that you recommended this medication and I just didn't want to take it. And we'll just, as long as you document that you offered it and I politely declined it, your doctor's going to be fine with that. My peers that I work with, if someone says, look, I understand you're recommending a statin and I just don't want to take it for whatever reason, just document that you recommended it and I politely decline, and we'll just move forward. And I would say, 99% of doctors are going to be fine with that. And they're really just trying to cover their ass with a lot of these statin prescriptions. And as long as you let them document that they offered it and you declined it, it's really not a big deal. And most people will just move on from there. So, I think that's my advice to people is just monitor everything, work with your doctor. And if they're really stuck on the statin thing, just tell them to document that they recommended it and you didn't want it.
That's a great bit of advice. Thank you. So my last question is I'd like to talk a little bit about your book. So a lot of what we discussed today is in your book, and you talk about the protein energy ratio. You have a section with some recipes and cooking, and then you've got exercise at the end. Do you want to expand on that a little bit for us?
Oh, well, yeah. I mean, everything we've talked about today is in the book, and you can purchase the book at thepediet.com. The name of the book is The PE Diet, and it's at thepediet.com. And really, the big points of this book are, number one, prioritizing protein for satiety. Number two, do some sort of reduction in carbohydrate frequency so you're more fat adapted. That could be just eating carbohydrates once a day, or being on a low carb diet, or intermittent fasting, or we talk about all the different strategies for lowering carbohydrate frequency. And then the other big pillar in the book is high intensity exercise, brief, maximum intensity resistance training to put the highest amount of tension you can in all of your muscles to try to get as much lean mass as you can, because the whole goal in life is to get the highest lean mass at the lowest fat mass. So you have to generate this stimulus for muscle growth. And it's basically slow, perfect form, pushing, pulling, and squatting movements. So we talk about body weight exercises you can do at home, push-ups, push-up variations, pull-ups and rows and pulling variations, and different lunges and squats and other leg exercises. And so I'm encouraging people to do just these really short, we have this 7-minute workout in the book, this nano workout with just a single set to failure of pushing exercise, pulling exercise, and squatting exercise. And people can do this at any level. They can start out with a wall push-up if they can't do a regular push-up. There's basically infinitely scalable from the easiest exercise all the way up to the very hardest. And it's just a really easy way to get in the door of resistance training. And that's what we kind of outline in the book.
And maintaining that muscle mass is so important, isn't it, for health and longevity, and, reducing that sarcopenia and all those things that we talked about. So.
Oh, yes. Muscle is the organ of longevity, and the stronger you are, the longer you're going to live. And so you really do want as much muscle as you can get.
And I think the little workouts that you've got in the back of the book, as you say, they're very scalable, 7 minutes. You can do them at home. You don't need to go and join a gym. You don't have to buy special clothes. You can just do it in your old trackies and shoes and,
Mm-hmm. Yeah, exactly.
Yeah. Excellent. Is there anything else you would like to mention or talk about?
I don't think so. I'm sure I've probably bored people enough already.
I think people will be absolutely fascinated with what you've had to say. I really thank you for your time. You've given us an hour and a half today. That's incredibly generous of you for your time. And I absolutely encourage everyone to go and get your book. I really think that your book is so well balanced, and I just think everyone in the country would benefit from following your principles in that book.
Oh, wow. Well, thank you. Thank you very much.